Good morning. Thank you for joining us for another Ministry of Health virtual media conference on this bright Saturday morning. We just had a bit of rain, but it's generally a bright day. As usual, we bring together subject matter experts to provide you with up-to-date information on the national COVID-19 response. Our panelists today are the Honorable Terence Dayal Singh, Minister of Health, Dr. Roshan Parasram, Chief Medical Officer, and Professor Michelle Montai, Professor of Immunology, Faculty of Medical Sciences at the University of the West Indies St. Augustine campus. I am Candice Alcantara, Manager Corporate Communication for the Ministry of Health and your moderator this morning. We go directly to the Chief Medical Officer for the clinical update and some additional information on identifying fake news.
Hi, good morning. Thanks, Ms. Alcantara. Good morning to the Honorable Minister. Morning, Professor Montai, and members of the media, members of the viewing and listening public. So I'll begin first, if I could have the first slide, with the usual clinical update for the 23rd of April, 4 p.m. And as you all would have noted, there were 104 new positive cases over that period. Our number of tests done at both the public and private facilities now stand at 124,301. Bringing our total positive cases to date as of 12th of March, 9,487. Total recovered persons to date, 8,092, with an active caseload of 1,238 and 157 deaths. Those patients in hospital, total patients in hospital now stand at 121. I'll give you the breakdown in a short while. And total patients in step-down facilities, 8. Those in state quarantine, 248, and those persons in home isolation, 1,005. In terms of number of persons vaccinated, this was earlier in the afternoon, 4 p.m. yesterday, 27,697. As we break down the hospitals a little bit further, so breaking down that 121, we have 75 persons at the Couva Hospital and Multi-Training Facility, 6 persons in ICU, 9 persons in the high dependency unit, 12 persons at the Cora Hospital, 25, and 21 persons at the Scarborough Regional Hospital at Fort George. If you can go to my second slide. So I'll just be touching a little bit on the other slides, how we detect fake news. So as we know, it is very easy for anyone to create fake news and share it widely to various members of the public and through various platforms. The persons may not be even aware that the news they share is fake. And before you share the information that seems to be accurate and official, take a minute and analyze the information. Next slide. So if you can go, there's supposed to be a second slide before this one. Just go one forward then. Yeah, so it is basic, right? Yeah, so it's how to spot fake news. So again, we start on the left, we're going assess the source. So where did the information come from? Read beyond the headline. Of course, reading the entire message always helps to demystify what is inside. 3, who wrote the article? So look at the source, look at and see if the author is a professional or subject matter expert in this particular area. Check the date. So is the current or most recent information being prepared? Sometimes we have seen things being shared a year or two after the actual date or reshared. To create impact. Examine the evidence. Is the data true? Compare to other trusted information sources. And of course, check for biases. Am I reading this with an open mind or are we looking to find something? Slide 3, which will be one back, yes? Right, so the official sources of information from the Ministry of Health. As you know, the media conference, as we have been having, and this one today, the other sources will be media releases coming from the Ministry of Health, of course, the Office of the Prime Minister, and other ministries. Social media is this information on the official Ministry of Health web page, Facebook, Twitter, Instagram, YouTube. And lastly is the information on the website from www.health.gov.tt, which is the legitimate Ministry of Health website. Last slide. So basically, if you're not sure that the information is accurate or official, then please don't share because we'll be propagating something that is erroneous and spreading it to the population. So Ms. Alcantara, that's my clinical update for this morning.
Thank you very much, CMO, and we hope that members of the public will assist us in ensuring that the information that they share is accurate, and they can feel free, as indicated, to look on all of the Ministry of Health social media pages and website to ensure that the information was indeed sent by the Ministry of Health before sending it to any one of your contacts. We go now to Professor Montai, and we're very pleased to have her here with us this morning. What she will do this morning is bring together two very topical subjects relating to COVID-19, COVID-19 vaccines, and COVID-19 variants of concern. We go to Professor Montai.
Good morning, Trinidad and Tobago. Terence Dayal Singh, Chief Medical Officer, Dr. Roshan Parasram. Thank you so much for your kind invitation to me to share a little bit about what we know about the efficacy of vaccines against the SARS-CoV-2 variants of concern. Can I have my first slide, please? Next. Today, what I want to do is to start by sharing a little bit about what we know constitutes protective immunity against this virus, the SARS-CoV-2 virus. And the first thing to note is that it is complex. We can break it down into 4 different parts. So we have antibodies that are specific against the SARS-CoV virus. We have memory B cells. We have CD4 T cells, which orchestrate the response against that virus. And we have virus-specific CD8 T cells, which will kill cells that have been infected with the SARS-CoV-2 virus. Now, very often we hear about the antibodies alone. And the reason is because it's very cheap to, in fact, measure antibodies against the SARS-CoV-2. But by only knowing about the antibodies, we're only knowing part of the full picture. So just hold that thought, because we are talking about antibodies, but it's only part of the full picture. Next. So I know by now that many of you know what variants of concerns are. And these are, in fact, mutants of the original virus, which is the Wuhan strain. And these have come about because they have some advantage that allows them to continue to circulate among communities. And we have 3 that are of particular interest to us: the UK strain, the South African strain, and the Brazilian strain. And these are now present in many countries. And the reason why they are so durable is because they are more easily transmitted from one person, so they're more infectious. They also increase the severity, or at least we believe that they may increase the severity of the infection that people get. And what is perhaps most concerning is that they, in fact, are able to evade the immune system, that protective response, to some extent. Now, here in Trinidad, in terms of community spread, we certainly have had for the longest while the original strain, the Wuhan strain, and more recently we have heard that the Brazilian variant has been found in several people in different parts of Trinidad. I also understand that we were able to contain the UK strain from getting into the community here in Trinidad, and as far as I'm aware, we have not seen the South African strain. Next slide, please. So what about the vaccines, and how will when we get them and we make immune responses, how effective will these immune responses be against the variants? Now, this is a very complex slide, so let me sort of work through this table with you. So what I have highlighted are the vaccines that we have, such as the AstraZeneca, or those that we will be getting, the Pfizer-BioNTech and the Johnson & Johnson. In that first column, which says efficacy against the Wuhan virus, you're seeing various numbers. And what we have here are the results of the work that was done in the field. In other words, when they were checking the Pfizer or the Johnson & Johnson or AstraZeneca, they gave the vaccines to thousands of people, and they gave, in those same communities, dud vaccines that were not against the virus. Might have been just saline salt solution. And then in these groups, they compared the rate at which the infection, COVID-19, occurred. And based on that, they were able to work out the efficacy against the Wuhan virus. So when we look at Pfizer, when you see 95% efficacy on an individual level, it's really suggesting that you as an individual have a 95% reduced chance, if you're immunized with that, of getting the virus. So let's look at the other columns. So the efficacy against the UK strain, the South African strain, and the Brazilian strain really come about not from these field studies as against the original strain, but really from work done in the laboratory. So what happens in these cases is that the researchers look at the efficacy of antibodies in the blood of people who have either recovered from infection or have been vaccinated and see in the laboratory how good they are at preventing the SARS-CoV-2 from entering cells. So in some ways it's not quite the same, but the work from the laboratory gives us a pretty good clue of what might happen in real life. And what we see as we look at the vaccines that we will be getting is that the Pfizer, the Johnson & Johnson, and the AstraZeneca that we have here, they are all very efficacious against the UK viral strain. All of them are not quite as good against the South African strain, but reduced levels of efficacy, reduced efficacy does not mean no efficacy. And in fact, there's very good evidence that even with weakened responses against the South African, that these vaccines can prevent severe infection and death. Now, when we look at the Brazilian strain, which is of great importance to us at present, we're seeing that the AstraZeneca, which we are now immunizing with here in Trinidad, is very efficacious against that Brazilian strain, as is the Pfizer-BioNTech. The Johnson & Johnson, when they were doing their clinical trials in Latin America, the Brazilian strains started to circulate, and there was reduced efficacy, but there again, no efficacy. I want to stress again that when we're looking at antibodies and the antibody ability to prevent infection with the virus against cells, preventing the virus from entering cells, we are still only looking at part of the immune response, because we're not looking at all the other parts that I spoke to you about. So we really need to go and look at real world results. My next slide, please. So here we have, there are several countries, the United Kingdom, the USA, and Chile. And what we are finding here, these are some scary looking curves, so let me walk you through these. These are countries in which we have many of these variants that I've spoken about circulating. In the UK, for example, we definitely have the UK strain as the predominant variant, but we've also had quite a lot of the South African strain and a little bit of the Brazilian strain. So what we are trying to show in the blue line, what we're looking at is the degree of hospitalization and, or really the degree of severe infections among some of the most at-risk people for severe COVID infection, the people who are over 85 years of age, people who are in that age group, 20% of them will die if they get COVID infection. And when they began in the UK to immunize this population, in the presence of the UK variant circulating, in the presence of the South African variant circulating, they found that there was this marked drop in the rate of hospitalizations and ICU bed occupation in this age group, certainly far more so than the younger age group who had not yet been vaccinated. We can go to the US, and as you know, they are now actually they have been ramping up more recently their immunization. They have all the strains circulating, the UK strain, the South African strain, the Brazilian strain. And again, in this at-risk age group, the 85 years and over, when they have been vaccinated, you are seeing less hospitalization. So what is, in Chile has some problems. I believe they have the Brazilian strain, but again, in that risk group, the aged, you're still seeing less hospitalization. So what this is telling us is that even in the presence of circulation of these dangerous variants, that vaccination is providing protection, and certainly decreasing in at-risk populations, hospitalizations, and ICU admissions. So do you need any further advice as to why you should not get vaccinated? So my next slide, please. So I want to encourage you to get vaccinated. I want to also say that people who are getting vaccinated, it takes a while, good things take a while, and even after your first dose, it takes about 3 weeks for your immune response to really ramp up to what is optimal. You should still take the second dose because 2 doses protect you as better. So get vaccinated. I want to encourage everyone who can get the vaccine to get it, but we also need to continue to wear our masks, wash and sanitize our hands, maintain social distancing, and limers, limit your liming. And that is because we still have many people who are not immunized, and the world needs to be immunized before we can all remove our masks. Thank you so much for your attention.
Thank you very much, Professor Montai, for encouraging all of us to get vaccinated as soon as we are eligible. Thank you very much. And we go now to a statement from the Honorable Minister of Health, Terence Deyalsingh.
Thank you. Thank you very much, Candice. Good morning to the Chief Medical Officer, Dr. Parasram. Professor Montai, thank you very much this morning for a very learned explanation about where we are with vaccines, how the vaccines work. Your explanations this morning were spot on. Thank you very much for lending us your expertise once again. Good morning to ladies and gentlemen of the media and the national public, wherever you are. It's been a while since I have given you the global context of where we are. And I think the issue of pandemic fatigue, which has set in, blinds us to the fact that the pandemic continues to rage on. As of April 24th, this is the updated figures, there are 146,466,095 cases of coronavirus around the world. 146 million. I remember months ago we were talking about milestones of 25 million, 50 million, 100 million, and here we are. Deaths to date globally, 3,103,151. That's 3.1 million persons who have unfortunately passed, and 3 million families who have lost a loved one. The daily new cases as of April 14th, and it's probably higher now, it had started to peak around January at around 800,000 cases per day. That was the peak. Then it started to go down in February, and it bottomed out at around maybe between 200,000-300,000 cases. It has now gone up again to over 800,000 new cases around the world. We are hitting new peaks as countries surge more and more, and you are seeing it around the world. So the global pandemic, even though we are tired, the virus continues to rage. In light of that, Trinidad and Tobago started its vaccination program, as you know, on Tuesday, 6th April. We had set an initial target of 1,000 vaccines per day. From day one, we started to meet and beat those targets. Day one, we hit 1,153. We started to add mass vaccination sites on Thursday the 22nd, in addition to the 21 sites that we had. The addition of these mass vaccination sites on Thursday, which was the first day, the Queen's Park Paddock, Tacarigua Racket Center, we saw an impressive jump on Thursday 22nd to 2,932. Yesterday's figures, which was the second day of the mass vaccination sites, I got these figures this morning because these figures came in very late last night. 4,295, which is a phenomenal achievement, and we thank the public and we thank healthcare workers. So in addition to the 21 sites, we started to add other sites, Morvant, Carenage, Health, and St. Helena. So we now have about 26 sites across the country, 24 sites in the public health sector, and these 2 mass vaccination sites. To date, with the figures I got this morning, we have vaccinated 29,237 persons. So this weekend we are crossing the 30,000 threshold. That might have been crossed this morning already. On the issue of vaccines, I want to alert the population and echo the sentiments expressed by Dr. Caressa Etienne, speaking about the need for the population to only take COVID-19 vaccines through national programs at this time. And why did Dr. Caressa Etienne send out that? And I want to quote liberally from a press conference that Dr. Caressa Etienne may have had on Thursday. In a press release, PAHO warned that getting vaccinated outside legal programs, which is what the government is running, could be dangerous to your health. And what were some of the reasons given? They are: 1, the recommendation comes in response to reports of counterfeit or unauthorized vaccines in some Latin American countries. Ladies and gentlemen, there are counterfeit vaccines out there. There are unauthorized vaccines out there that we who are running a national program, when we rely on evidence from our sister international partners like PAHO, like WHO, like CARPHA, we are protecting you, the public, from falling prey to unauthorized vaccines, counterfeit vaccines, and now the new trend is to take expired vaccines, repackaging them, and sending them to countries that don't have strong vigilance systems. The government of the Republic of Trinidad and Tobago will do everything in its power to do 2 things. 1, only bring in authorized vaccines, and 2, protect you from charlatans who seek to profit by bringing in either unauthorized vaccines, fake vaccines, or expired vaccines which are being repackaged. Dr. Etienne continues to say, in March, the World Health Organization issued a global alert about counterfeit Pfizer-BioNTech vaccines. I don't like to call the countries' names but it's there in the public record. She goes on to say, people are advised to use only authentic vaccines as directed by national authorities. Because if we don't do this, and you are vaccinated by a fake vaccine, a counterfeit vaccine, or an unauthorized vaccine, it could lead to an increased prevalence of COVID-19. As Professor Monteil has just given you the efficacy rates, we want to stick to those official efficacy rates. She goes on to say, this could lead to increased prevalence of COVID-19, which will send us back to where we were. Potential adverse and even toxic or fatal events. I have said continually, we must not sacrifice public safety for expediency. And loss of trust in the health system. Trust is a crucial ingredient in this vaccination program, as well as social and economic consequences of unpredictable magnitude. These are very strong warnings coming from PAHO. We are going to be very, very vigilant when we allow vaccines to come into Trinidad and Tobago. So this clear warning about fake vaccines, unauthorized vaccines, counterfeit vaccines, and expired vaccines, which are finding its way into healthcare systems that don't have robust surveillance systems, these represent a clear and present danger, not to only our health, but also, as Dr. Etienne has warned, as well as social and economic consequences of unpredictable magnitude. So far, we have launched a national vaccination program which is robust and which people can have faith and trust in. And I want to express my thanks and gratitude again to the close to 30,000 persons who have expressed their faith and trust in our vaccination program. Before I close, I have been visiting as many health facilities as possible. Yesterday I visited La Romaine, thanked the healthcare workers there. I interacted with members of the public who are all pleased. I got not a single complaint. I then went to the Marabella facility, same picture. Healthcare workers are once again rising to the challenge. I spoke to patients again, not a single complaint. I went to the Couva Hospital, which we are activating this morning. I then went to the Tacarigua Racket Center. Again, patients and staff have responded magnificently. And when I leave here, I am going again, because I was there on Thursday, to the paddock to see what they are doing. I also on Thursday visited TPHL and CARFA to thank them for the wonderful work they are doing again. Because with the increase in cases, increase in testing, increased pressure on our human resource. So all our people are once again rising to the challenge. But before I close, I want to echo what Professor Monteil has been saying, and in her slide, item 5, the lineman. I know we are sounding like a stock record, and Professor Monteil, thank you again this morning. It is the lineman and the socializing in that 20, 29, 30, 40, early 50s age group that is driving this second wave again. Please, let us get on board with the program, which is curtail your activities to essential activities, which are working, groceries, supermarkets, pharmacies. We don't need to be linemen. In coming to this press conference this morning, I could not help but notice right outside TTT, right across from TTT, there's a bar. And you had fellas linemen outside the bar lining up on the railing, sitting down on the railing outside TTT with their beers in hand and masks off. This is the type of behavior that we are trying to discourage. And I want to congratulate the TTPS, but don't give them too much of work. Let us be responsible. Let us be responsible. That picture that is being played out outside TTT in that bar is being played out across the country. We get the reports, we see the photographs. We are urging the limers, as Professor Monteil just did, don't be a part of the problem. Let's all be a part of the solution. So Candice, I thank you, and back over to you.
Thank you very much, Minister Dayal Singh. Let's all be a part of the solution. We go now into the question and answer segment. We remind our media representatives, please begin by stating your name and the name of the media house that you represent before putting forward no more than 2 questions. Please be brief, and we ask that you pose both questions at the same time. We begin with questions from 98.1.
Good morning again to you, Ms. Alcantara, and welcome back. Stephen Cummings here, 98.1 FM. Good morning to the entire panel. My 2 questions quickly. One for Dr. Parasram and the other for Professor Montai. The other question can be shared with Professor Montai and or Minister Dayal Singh. I'll start with the CMO. CMO, the 60-year-old elderly who died recently, I believe, after reportedly taking the AstraZeneca vaccine, and for those of us who have not had the benefit of seeing a coroner's report or findings of a pathologist, is there any update that you can share with us at this time on the occurrence? I remember you saying at the previous setting that a report was being compiled by the Southwest Regional Health Authority. And secondly, Professor Montai, and this question can also be responded to by Minister Dayal Singh. We appear to be reporting the discovery of new variants with some measure of increased regularity. Is this influencing a different way in our outlook at the virus and our vaccination program? The discussion has already begun on the issue of possible booster shots, even annual or 2-year inoculation exercises, which will take us into another round of fresh protective action. Is this influencing a shift in focus? Thank you.
Okay, so with regards to your first question, yes, I did receive the report, as I said, from the SWRHA regarding this particular patient. Southwest Regional Health Authority, their executive team, has had a full disclosure meeting with the family this week. I don't want to go into details with that particular case, but I can assure the country that we have not had any cases of vaccine-induced thrombocytopenic thrombosis, which is VIIT, which is the syndrome, of course, where you have a vaccine, usually 4 to 11 days afterwards. People tend to have thrombosis generally in the venous system. Can happen in other types of blood vessels, generally in the venous system, generally as well, because it's thrombocytopenic. You find there's a decrease in the level of platelets associated with it, hence causing bleeding and clotting. So we have not have any of those instances occurring in Trinidad and Tobago as of yet. If I do, we also refer those matters to PAHO WHO if they arise, as well as to the manufacturer of the vaccine for further intervention, but we have not had any of those instances as of yet.
Thank you, CMO. And Professor Montai, can you please address the second question from 98.1, please?
Thank you so much for that question, which is a very pertinent question. I think that what we have to wait to see is what is the real life, what will happen in the coming months with more vaccination. If we're to look at the UK, where they've been really successful in immunizing quite a lot of their population, you see that the numbers of cases have dropped and also the numbers of deaths are less than 40 per day, which is a big drop from the 1,200 odd that they were having in mid-February. So that we still have to see what is the real life outcome of vaccination. Now, a lot of companies have already started to make booster shots for, let's say, the South African variant. And they may be needed in some populations. In other words, people who don't make great responses, you might need to have that for them. But if we are to look at as I said, the real world experience, like the UK, where you are actually having big drops in the presence of circulating variants, then we may not need to use these booster shots in the vast majority of the population. So I think we have to wait through the next month. And again, immunization across the world, as many people in this world who we can immunize will stop the spread. It's the transmission and the ability of the virus to get into people who haven't yet got a response, where it can multiply, that drives mutation. So if we can stop that, and because more and more people in the world are being immunized, we might not need many of these boosters really on an annual basis. Maybe occasionally you might have an epidemic in a particular part of the world, and maybe there's some populations you might particularly need to keep them safe. But we have to wait and see. We have to wait and see.
We go now to AZP News, please.
Hi, good morning, Private Harry, AZPnews.com. My first question, I just want to get some clarity on new regulations that state that religious services are reduced to 25% capacity in church, and funerals and weddings are only allowed 10 people. but people are asking whether a funeral and a wedding could be considered a religious service, and therefore there could be 25% capacity. Some ambiguity there, right? So I just want to clarify.
Okay.
And my second question is, has the policy of the vaccination changed in that people who are under 60 and who may or may not have NCDs are getting vaccinated, and therefore the people on the initial list, that is people like frontline healthcare workers, teachers, etc., they are not being vaccinated, and other people are therefore being vaccinated. Now, can you also explain that right now? Thank you.
Sure. So I will take those two questions because those are two government policy questions. So the regulations are pretty clear. Anything being held within a place of worship, church, mosque, mandir, 25% capacity. So if you are having a wedding service, a funeral service, 25%. If you are in the public domain at a grave site or whatever, you are limited to 10 persons. A wedding in a public place, you're limited to 10 persons. Okay, so I hope that clears that up. The issue of age. So, phase 1 was dedicated to healthcare workers regardless of age. So you have a nurse, a doctor, whatever classification of healthcare workers could be vaccinated regardless of age. The age limitation came in for persons with NCDs within our clinics or members of the public. You had to be over 60 with NCDs. Okay, so I hope that clarifies it. Then we started to make inroads into phase 2, where we started with members of parliament regardless of age. Today, as you know, we are doing members of the media regardless of age because we consider them the frontline media workers. We are doing local government practitioners regardless of age, as we said clearly. We are also doing the judiciary today regardless of age. We did yesterday members of the parliament staff regardless of age. All right? So that is where we are with phase 1 and phase 2, and I hope the age explanations clarifies the point prior. Thank you very much.
Thank you, Minister. And we go now to TTT, please.
Good morning, everyone. Kimberly D'Souza from TTT News. My question is for Minister Dialsingh. Minister, the Barkeepers and Operators Association, they released a statement and they're saying that as much as they agree with the new public health regulations to mitigate the spread of the virus, they do not agree that they should be held responsible for persons congregating in front of their establishments. So instead, they are suggesting that, that the authorities consider prohibiting the consumption of alcohol and all its related products for a period of 60 days, and instead implementing an open container policy with respect to alcohol for the purpose of consumption in all public places. I just wanted to get your thoughts on that, Minister. Do you think this is feasible? Do you think the authorities would consider it? Thank you.
Okay, so thank you. I did see that, and I must really commend the Bar Owners Association. Those two gentlemen with whom I converse with on a regular basis have been very, very cooperative. The issues that they have raised are issues that have to deal with the TTPS and possibly the Honorable Attorney General. I will be contacting him during the course of the day to see if that is possible, but I cannot say yea or nay at this point in time because that may require some legislative tweaking. I have no idea whether that can be handled under the regulations or whether a special law needs to be passed. But the TTPS, I did see the TTPS make certain statements last night, and I am guided by those statements, and I will be conferring with the Honorable Attorney General on the second part. Thank you very much.
Thank you, Minister. Now to CL Communications, please. Are we ready with CL Communications?
Hi, good morning.
Good morning.
Morning.
I just was wondering if there are PCR tests available or antigen tests or kits and vaccines, why is it that the borders continue to stay closed? That was a question posed to me by a member of the public. And then secondly, given that trends show that the Brazilian variant targets generally young people, does it mean that school children who are going to physical school, would they be returning to online schooling? I'm referring specifically to the forms 4 to 6 students. Okay, thank you.
So I will take the second question first, and the CMO will take the first question second. So any decision about schooling and returning to school will be announced by the Honorable Minister of Education. Of course, we work with all our sister ministries to advise and guide. Right? CMO.
Yeah, so of course, decisions related to the borders remain ultimately with the National Security Ministry, but our guidance has been, and when you look back at the start of it, when we had our first few cases in Wuhan, China, we had made a recommendation that the borders be, of course, travel from that particular jurisdiction be limited for persons who would have been there for 14 days prior, based on the incubation period. And the premise of it was really, of course, at that point in time that we had a new disease spreading between our countries, or there was frequent travel between us and them. And then, of course, there was increasing prevalence of that disease. With, as Professor Montai would have gone to great lengths to say, prevalence of the other variants, UK variant, the South African variant, continues to remain high in a number of territories outside of Trinidad. The prevalence of the virus itself, in terms of its sheer numbers, remain very high. So in terms of avoiding us getting those variants coming in, and again getting our immunization of the population going quickly, so that we get that herd immunity before we have variants introduced in the country. Of course, we have noted the recent introduction of P1, and I was happy to see on the slide from Professor Montai that the efficacy of the AstraZeneca in particular remained the same for that particular variant. It's not the case for the South African variant, however, and we have seen in South Africa that they have abandoned the use of the AstraZeneca vaccine because of the effect or decreased efficacy for that particular variant. And we want to keep all the variants out as long as we can to give our country the time to vaccinate our people, protect everyone, and then we go step by step from there. I hope that answers the question.
Thank you very much, CMO. And we go to Professor Montai now, just to address the statement from CL Communications about the Brazilian variant and the age group that it targets usually. Could you clarify that for us, please, Professor?
Thank you for that question. Certainly the Brazilian variant in Brazil certainly seems to be targeting younger people and also children, including children. It doesn't mean that, again, a lot depends on the AstraZeneca, which we're using, is good against that. And if we get vaccinated, we have just heard the groups that are the phases that are ongoing now. If Trinidadians will step up to the plate and get vaccinated so that it stops the spread of the Brazilian variant, we will be able to open our schools. So I think that the next few months are critical for our population. And I really urge everyone, we want our children to have normal education. We want our children to have normal development. And that's not happening now. So please, step up to the plate, adults, and be vaccinated. The AstraZeneca and the other vaccines that are coming are good against this Brazilian variant. It will protect our children and allow them to go back to schools. Thank you.
Thank you, Professor. And going back to you again, a question that we see linked very closely to vaccination. Do I still have to follow all of the guidelines if I'm vaccinated? And if so, why get vaccinated?
Yes, you should follow all of the guidelines to, following vaccination. Now, after the first dose, as I tried to say earlier, it takes about 3 weeks for immune response to really ramp up. The immune response is working on it. And after about 3 weeks of the first dose, it's about the best response you could have had to that first dose. It doesn't mean that you should not get your second dose. That definitely boosts and give you even a more optimal protective response. So that's important. Get your 2 doses. The reality is that everybody is not vaccinated, okay? And to some extent, we need the world to be vaccinated before we can relax. If we look at the example of Israel, where they actually have had a vast number, a large part, they're approaching what they call herd immunity, about 70% of their population having both doses of the Pfizer. They have relaxed considerably, where they are actually having people being able to walk around without masks. They are being, there are certain parts of the population that they have to protect a little bit more. But we are not there yet. We are not there yet. So while you're vaccinated, you still have to, in fact, wear your mask, sanitize your hands, etc. The reality is that the vaccines definitely decrease the rate of transmission, but it doesn't go all the way down to zero. And so I still urge you, until everyone is vaccinated, until we have that collective immunity that stops the virus spreading, we all have to continue to follow the other rules. Thank you.
Thank you very much, Professor. We go now to TV6, please.
Hello, good morning. Vanessa Cutting, TV6 News. Members of the public would like an explanation on the rationale behind the ministry's decision to allow places of worship 25% capacity, while other spaces are allowed only 10 persons maximum for the same types of events, while others are in fact completely disallowed from having events at all, which would have been observed under similar protocols. And also, TV6 received an email from a concerned parent of a student at Diego Martin North Secondary. We're being told that there's an outbreak at the school and that the school officials were advised of the situation, but school continued as normal on Thursday. So I'd like to find out whether there is indeed a cluster of cases at that school and when the school would have been advised of this development. Thank you.
Okay, thank you very much, Vanessa. So the logic behind places of worship was simply to get people to stop congregating in large numbers. That has always been the mantra around the world. The more people congregate in large numbers, the more spread you have. Places of worship, again, if you look at the demographic across places of worship, it tends to be the middle-aged and older persons who attend places of worship. And they are the ones, by far and by large, who unfortunately suffer the fatalities. So those were the scientific reasons for reducing places of worship. The 10 persons apply to in public. So you can't have a public gathering for more than 10. Okay? On the Diego Martin issue, I think the Ministry of Education will be the best agency. So if I could ask you to direct your question on the Diego Martin School to the Ministry of Education, but the Ministry of Health is always prepared with protocols and procedures for other agencies to implement to protect those under their charge. Thank you very much, Vanessa.
Thank you very much. And we go now to a question that was sent in to us from CNC3 of Guardian Media Limited. What systems does the Ministry of Health have in place to accommodate persons who are blind and, by extension, persons with disabilities who need to be vaccinated or who are eligible to be vaccinated?
Yes. So, thank you very much. So, I will take that question. All vulnerable populations, and I had this study done about, it's a good thing you asked it, about 3 weeks ago. Persons in vulnerable populations will be vaccinated in phase 3. What do we consider? I had a study done not only for blind, but the physically handicapped. I also had a study done under mental health conditions and seeing what Australia, Canada, UK, United States are doing to vaccinate all vulnerable populations. We already have a database from the RHAs of people like shut-ins and so on. So we'll be targeting that in phase 3 of the mass vaccination program, where all these special populations, the blind, the handicapped in whatever way, persons with mental health issues, will be vaccinated in phase 3. And we are looking at the policies, as I said, prioritizing vulnerable populations for the COVID-19 vaccines. I have a country matrix here, and we'll be following the guidelines in countries like Australia, Canada, UK, United States, so they are being actively considered. But measures are now in place, and I saw it on TV last night, for persons who are being vaccinated. We have wheelchair accessibility to all our sites and so on. So it's always uppermost in our minds. So thank you very much for the question.
Thank you, Minister. We go to a follow-up question now from AZP News, please.
Hi, morning again. I just wanted to ask a question again about the NCDs and the vaccination. I don't want to find out, is it that everyone on initial priority list, for example, people with NCDs over 60 and frontline healthcare workers, have that, all those people, have they been vaccinated, and now we are going outside of that initial priority list to vaccinate people?
No. So the short answer prior is no. We opened it up and made it available. It's a voluntary system. It is not a mandatory system. So we opened it up in phase 1 to healthcare workers. So any healthcare worker who wants to be vaccinated, the facility is there for you to be vaccinated. We started again in phase 1, opening it up to persons over 60 with NCDs in both the public sector and the private sector. When I visit the facilities, I see these people. What we started to do in phase 2, we wanted to keep the organs of state running because the general public depends on parliamentarians. So you want parliamentarians to be vaccinated, regardless of age. You want local government, because without a functioning central government and local government body, the public will suffer in the end. You wanted frontline police to be vaccinated, because national security is important. You want your judiciary to be running, so we vaccinated them today. You want media up and running, so we vaccinated them today, regardless of age. So that was the rationale for doing phase 1 and phase 2 concurrently, because we got in more vaccines. You remember the initial talk was that when we got in the 36,000, are we only going to vaccinate 17,000 or open it up? Because we got the tranche of vaccines from SII, we were therefore able to do phase 1 and phase 2 concurrently and vaccinate hopefully 37,000 persons in phase 1 and phase 2, based on high exposure, high risk. Okay? So Priya, I hope that completes the answer, and thank you for asking it.
Thank you very much, and we go now to 98.1.
Thank you again, Ms. Alcantara. My question, this one for Minister Dayal Singh. Minister, you earlier on had an advisory, for the public, and you were talking about, advising against fake vaccines. I'm wondering what are the measures that are in place now? Is there like a multi-sectoral task force, apart from the police, obviously, that would be able to, that's in place to monitor and to be able to detect fake vials? What is in place now? Because, we have always had the discussion about leakages in the system. We can even go as far as talking about porous borders, but that's probably for another discussion. What is in place now to ensure that we are safe and we are monitoring these vaccines as they come in?
So, from a policy perspective, and the CMO will go into details, we work closely, Chemistry, Food and Drugs falls under the Ministry of Health. We work closely with the Minister of Finance because that is where customs resides. Recently, the Minister of Trade and Industry got a note approved in Cabinet to address the whole issue of fake products across the board, whether it's fake car parts, whether it's fake food, and fake drugs and medicines. So at a policy level, that is where we work. Operationally, and that is where we are so careful how we engage the private sector. This is very crucial. We want to work with all bodies, but we always ask the private sector these very difficult questions. Where are your vaccines coming from? What are the batch numbers? What are the expiry dates? Can you guarantee cold chain integrity? Do you have an indemnification agreement with the manufacturer? That's the policy position that the Ministry of Health imposes to keep you safe and everyone away from fake vaccines, counterfeit vaccines, and repackaged expired vaccines. The CMO will go in now to the operational issues.
Okay, so yeah, I think we discussed this one before, but basically what it has is that we require the cooperation of the public as well. As you know, for the COVID-19 vaccine, the only vaccines that are registered for use in Trinidad right now are the AstraZeneca vaccine from the South Korean site and from the SII site. It is being distributed only at through the public system at our 23 health center sites and our mass sites. So it gives us some assurance that if you can access it outside of those sites to start with, that they should not be legitimate. And of course, we need the public to look out, as they always do, for people for vaccines outside of that system, and of course alert us through the Chemistry, Food and Drug Division of the Ministry of Health. They are our agency who would administer the Food and Drug Act, and they, of course, if they pick up something, they will send that for testing, and we will have communique with the principals, usually AstraZeneca in this particular case, or any other company, to determine what is happening, and of course the necessary enforcement will follow.
And Mr. Cummins, that's why at the start, what I read out from PAHO, take vaccine shots only through national programs. So the members of the public, if any member of the public is offered a vaccine outside of the national program, chances are it's a fake vaccine, it's a counterfeit vaccine, it's an expired vaccine which has been relabeled, and it is dangerous to you and the public. We want to work with everyone, but for the time being, until policies change, the PAHO warning this morning, only take vaccines through a national program. That is the last line of defense against the public, a vigilant public, an informed public, which is what we are doing here this morning. So, Mr. Cummins, thank you for raising the issue again. Only take vaccines through a national program at this time. When we are going outside of the national program, we will tell the public that this vaccine from this private sector interest is safe. It has gone through the regulatory hurdles, and we can verify it. But for now, only take vaccines through a national program. This is the advice and warning coming from WHO and PAHO, and I stand by it. Thank you very much, Mr. Cummins.
Thank you very much, everyone. We have come to the end of this morning's media conference. Today, we highlighted the issue of fake vaccines and encouraged persons to use the national vaccination systems at this time. We looked at strategies to identify fake news, and we know that that's moving around quite a lot in Trinidad and Tobago. And we encourage persons, please only share information that they are sure is accurate. And Professor Montai highlighted for us the efficiency of all the approved vaccines, WHO approved vaccines, including the AstraZeneca vaccine, and urged all of us to be vaccinated when eligible. To date, over 29,000 persons have been vaccinated in Trinidad and Tobago. But we all must, even those who have been vaccinated, we all must follow the guidelines. Watch your distance from others, wash your hands, and of course, wear your mask.
This is TTT.